Yes, sir. You can start.
Okay. So shall we start?
Yes, sir.
Okay. Very good evening, everyone.
Yeah.
And I thank Dr. Rekha, who is a great friend of mine, for giving such an opportunity during this lockdown period. It's unfortunate that we can't meet face to face or in a classroom in an audience. But let me try to communicate to you as far as possible I could. Today's topic of discussion is the homeopathic part of the approach to the autism spectrum diseases. So today we shall discuss the scope of homeopathy. First, in 3 or 4 sessions, we will try to analyze the scope in homeopathy and how to take the cases in these type of diseases, of course with the case demonstration, and important milestones that we might come across while we treat successfully these sort of cases. With an apology means, since the time is very limited, I will concentrate more on the pure or the autism, established autism cases. As you all know, the spectrum is really wide, from simple behavioral problems, ADHDs, aggressions and other things, and to the full-fledged autistic picture. So today we will discuss some finer aspects because these are the tougher cases to actually handle. So let us move to some of the important points that we might actually like to listen during this management of these diseases. So in every established autistic case, we might, if we observe clearly or in a correct manner, very rarely only we might come across simple diseases or viral fevers or infections with fevers. Hope it is a known fact, at least among those who are really into these sort of cases. If you analyze or if you think, we can rarely only come across simple diseases like infections with fevers. That means simple infections are very much less in established autistic cases. And it is often, when I see these cases, it is often said, when I ask the parents about any probable illnesses or any other illnesses the child used to get, usually this is the exclamation I used to get. Oh, doctor, it's a blessing actually. We are fortunate that already we are suffering like hell, but fortunately we are not getting enough infections so that we have to carry these children to hospital, and that might have added our misery more. So this is the usual tag we will come across, right? But in reality, is it really a blessing or something bigger? So when we lose our capacity to react to simple bacteria and virus, we have to think in that angle. So actually in these children or people with autism, if we are not able to witness simple fevers, simple illnesses, which can produce high fever, we have to think, why is it so? So when we lose our capacity, when we actually lose our capacity to react to simple bacteria and viruses, it actually happens in 2 situations. Either when we are hope you can follow me. If we are in a really good shape or in a very good immune status, we might not get a fever, or when we are really sick or deeper in sickness, we won't get simple superficial illnesses. So, in the autism spectrum disease cases, it is the second situation which happens. Hope you can follow me. Also, in the autism spectrum cases, the center of gravity of the case is deep. Hope you all are familiar with the center of gravity concept, where actually the problem regarding or the core of the issue in a case resides. That is meant by the center of gravity of the case. You all know that the human constitution is made up of three different areas. The mental plane, which is the deepest one, then comes the emotional plane, and then comes the physical plane. So in mostly these sort of autism cases, since it is a developmental disorder, neurodevelopmental disorder, the most cases, the problem lies in the mental emotional plane. So hierarchically, when we think about that, we can easily understand it is not a simple area to actually ponder. So multiple deep developmental issues will be there. So that also makes these sort of cases tougher. So it's a complex situation. Hope you can follow that. These type of cases are complex cases. Now let us analyze what are the simple cases in homeopathy and what does a complex case or a difficult case in homeopathy means. So in simple homeopathic case, that means when the symptoms are clear. It is not the diagnosis or the pathology makes a case clearer or complex. It is something beyond that. So actually when the symptoms are clear, what does it mean? The clarity of symptom. In an organism, if an organism has the capacity to throw out a clear symptom, that means that individual is in a very good immune status. So when we come across good, clear symptoms in our practice, that means that particular person is in a very good state of health. That's why he is able to throw out clear symptoms. And what does a clear symptom mean? As we all know, when the symptom is clearly represented with its location, sensation, modality, and concomitant in adequate intensity, that makes a symptom clear. Okay, for example, I will give you an example. When a case is presented to us, say a person comes to you and say, I am having intense headache. And if he can actually come up with the correct location, say the headache starts from the nape of the neck in the right side and extends to the temple in the right side. So there is a clarity in that, right? And in another situation, if another individual comes up and says, I have a headache. And on inquiry, where you have the headache, I can't say, doctor. Actually, the headache is a total headache. And he cannot actually relate the other things, other aspects also. The type of the headache, the type of the pain, any modifications for the pain. So these are the situations or the criteria by which we will get a clearer case, a clear symptom. So a simple homeopathic case doesn't mean the pathology is simple. When the symptoms are clearer, irrespective of the pathology, the same case can become simple to manage. The second point we have to discuss, we have to bear in mind is when we get enough keynotes of a single remedy. Say 3 or 4. So in the same case of a headache, if the same right-sided headache is accompanied by severe nausea, and if the patient is better by vomiting, that means the case is almost clear. So we get 3 clear keynotes in that case. That again gives us a simpler situation. So we all know the remedy, it is sanguinaria. So it is easy to prescribe sanguinaria here. So the strong symptoms of other remedies won't be there. We all wish an ideal situation, as I have explained, the simple symptoms, clearer symptoms, which are expressed with multiple keynotes of the same remedy. But if the same situation is mixed with other remedies or other stronger symptoms of the remedies, then what will happen? That will confuse the case. Okay? And if he says that I am becoming better by application of cold, then our expectations will fall, right? Then that is something else. So when there is no major contradicting symptoms, we expect the sanguinaria headache to become better by vomiting. And if it is not better by vomiting, then we will become confused. So when there is no major contradicting symptoms, so these are the criteria by which we will find a simple homeopathic case. So what happens in a simple homeopathic case? Yeah, it's very easy to select a remedy. And if we prescribe it in the correct potency, after the remedy given, we might see an aggravation followed by a great amelioration and a complete cure. So these are simple cases. With one remedy and one prescription, you can get a miracle or a marvelous result. So with one single remedy, we might get an astonishing result, which is becoming very, very rarer nowadays. So this is the point I want to mention here. As the case becomes complex, the single remedy miracle is not going to happen everywhere. So what does that mean? We need better understanding of the situation, and this is not a single remedy prescription case anymore. That doesn't mean that whatever indicated medicines come up, or what all indicated medicines come up, we should prescribe everything together. No, that is not the case. Now, the complex or difficult cases, you will get unclear or vague symptoms. And more than one remedy pictures come up, confusing the prescription. So when we start taking the case, we will get 2 or 3 symptoms of, say, Calcarea carbonica. So after some time, 2 or 3 symptoms of Natrum muriaticum come. After some time, say 1 or 2 symptoms, very strong symptoms of Medorinum may come. So we will be confused where to start, when to start, and how to proceed. And there lies the confusion or the problem with complex or difficult cases. So the remedy selection will be a tough ask. So you want to get a cure in such cases, one correct prescription won't be enough. So usually what we expect, we will find a remedy and give it an immediate fantastic result, the case is solved. So here in complex or difficult cases, after the first prescription, you might seldom only come across with a positive outcome. Instead, you might see some new symptoms appearing, some changes in the prescribed pattern. So based on the present, on the evolution of the new symptoms, you have to prescribe on a second remedy. Then comes the third remedy. So maybe after, say, 2 or 3 remedies only, we might be able to bring up a desirable change. to identify the first remedy, then identify the second remedy, the third remedy, the fourth remedy in the correct sequence and prescribing is the most difficult ask in homeopathy. There actually the homeopathy becomes tough, and there lies the problem in becoming successful also. So ASD, the autism spectrum falls in the difficult case spectrum. So in established cases, it is very difficult to reverse. So first we all should understand to how far we could be able to reverse the situations. In my experience, I haven't seen any case, any established case to be reversed completely. So the term cure in its perfect sense doesn't fit to these type of cases. Then, but we might be able to bring improvement in each and every situation with carefully selected remedies. And I can say with utmost certainty that we can do much better than the conventional behavior, conventional chemical therapies that is going on in the world. So be it is the aggressive episodes, the compulsive behaviors, the sleep issues, the tantrums, the pacings, restlessness, destructiveness, etc., etc. So everything, these sort of problems, we could be able to manage much better than the conventional medicines. So, therefore, the scope of homeopathy in any case depends on the basic level of health, the center of gravity of the case, and the depth of the pathology. Hope the thing is clear now. So first, we have to understand, or we have to assess the level of health of the person. If the person is having a reasonably good level of health, which is very rare in autism spectrum, we might be able to spring up few surprises. There, we actually come up with miracles. And that is the reason why the miracles are not repeating in homeopathy. Not in every case with the same pathology we will witness a great cure. This is the problem. Okay, so the scope of homeopathy. So as prescribers, our aim is just, it's an over enthusiasm to think or claim that we can cure everything with homeopathy. So it is not an easy nut to crack, especially if the level of health is really low. So ASD belongs to the really lower levels of health, and that's why we find it really difficult to prescribe. The remedy picture won't be clear. But in really mild cases or cases with good level of health, we get clear remedy picture and we might get astonishing results with the first prescription itself. I will give you an example. In one case, one boy of almost 3 or 4 years was brought to me, and the parent took almost say half to 1 hour to bring the child inside. He was crying. The first impression I got was he was actually crying because of fear of doctors. Of course, that it might be there. But on observation, on close observation, I found a peculiar symptom in that, and that cry itself. So whenever the child cries and the parent tries to hold him or try to pat him, that was making him worse. So it gave some kind of a revelation for me, and for me, a medicine was on the cards. But we cannot prescribe on such a speculation only. And on inquiry, I could find that the child was really fond of salt. If available, he will pick and put salt in his mouth. So the remedy is clear, right? And he was prescribed natrum muriaticum, and in all these 3 years, say I think I have made almost 3 years since the first prescription. In between, only once I have to use another remedy, C. hyoscyamus. The rest of the case was simply progressing with the different potencies of natrum muriaticum. And I could manage that case very well. He's into normal school now. He's in now he's around 8 years. I think he's settled in UK with his parents and he's doing his schoolings well. And the parents are very happy. So what does that mean? The clear symptom, the clear craving, the intense craving shows us that the person or that particular child was in a very good level of health. That's why the case is remaining in the same natrum muriaticum picture throughout these years, and that is very rare nowadays because of all these sophistications, all these usage of intense drugging, and all this mental emotional war, competitions, jealousy, hatred that we are undergoing. The constitutions are becoming really sick. So, in ADHD, behavioral disorders, etc., where there is no autistic features, we might be able to bring great cures, great results with a single remedy. So, if we have to say in a nutshell the scope of homeopathy, in established autistic cases, it is really a time-consuming exercise, and we have to wait, and we have to prescribe meticulously, and we have to take the follow-up very correctly to get even a slight improvement. But in other cases, like simple destructiveness, attention problems, behavioral issues, we might get fantastic results. So now coming to the second part, the case-taking part. As homeopaths, we all know our most important job in any homeopathic case is to individualize the case, right? Individualization of the patient, and at the same time, individualizing the remedy also, and making a match. And how individualizing an autistic child is different from that of a normal one. So there lies the problem. In normal case, so let us view few autistic expressions that commonly we might come across in our practice. Some abnormal body posturing of facial expressions, abnormal tone of voice, avoidance of eye contact or pure eye contact, behavioral disturbances, deficits in language comprehension, delay in learning to speak, flat or monotonous speech, inappropriate social interaction, intense focus on the topic, on one topic, the lack of empathy, and many more to follow. Okay. These all are common autistic symptoms or usual expressions that we might come across.